Hello, I'm Dr. Madeleine Attridge, GP partner with some out-of-hours experience. I've been asked to talk to you today about the management of sinusitis by remote consultation. So first of all, with all remote consultations, when I first ring up, I ask to speak to the patient first, because the patient's relative or a friend may not know that they've even called the doctor. So you've broken confidentiality if you've introduced yourself as a doctor to somebody who isn't the patient. I then document in the notes whether I'm speaking to the patient or speaking to their relative. I do at some point in the consultation ask to speak to the patient themselves. So the next point is to take a detailed history. Because you're potentially not actually seeing the patient face to face, you're going to need to take more history than normal and document more than normal. People often think telephone consulting or video consulting is less time consuming, but actually it can sometimes be more time consuming. So you're going to ask how long it's lasts for, how severe the symptoms are, whether they've got any green, offensive smelling, bloody nasal discharge, whether it's bilateral or one lateral, the discharge or the pain, any facial swelling, and what is the patient concerned about themselves. They might be concerned that this is going to go on for a very long time, or they might be concerned there's something else going on, and then you know what to reassure them about. So the next part, which is a bit more difficult over the phone, but you can go into a video link, is you ask them to press over their sinuses and describe where those are and are they tender at all. On the video you can actually get an idea of how tender they are, and you can actually see the facial swelling as well. The next part, so when you've made the diagnosis that this is likely sinusitis, you need to describe about how a lot just get better by themselves. It is quite a long duration for sinusitis and can last up to 3 weeks, so it's worth reiterating that to the patient that it's known to last a long time. But that 98 out of 100 are just caused by viruses, so antibiotics don't really have much of a role here. Now, they will know people who've had antibiotics for sinusitis, so you can talk about the situations when it would be appropriate, such as if you've got unilateral facial swelling with a high fever and you're systemically unwell, then that's a sort of occasion where we'd go for earlier antibiotics. Also, if the symptoms are going on longer than 10 days and they are quite symptomatic with it, then you might consider antibiotics then. For the first 10 days, we'd be talking about reassuring them with other ways to manage it, such as steam inhalation. I often tell them to take a shower before they go to bed, because it's often a lot worse at night. I tell them to sleep on several pillows to raise their head a little bit. They can try decongestants, although those aren't always of a lot of value. And then after 10 days, that's when we're considering the antibiotics, and I might consider some topical steroids as well. Finally, it's important to safety net that if they get worse, if there was no response to the antibiotics you prescribed, if they're getting new symptoms, they should always ring you back to check, because they might not be expected, those symptoms. And if you need to check with them if they're happy that the consultation's been done remotely over the phone, or did they still feel they needed to be seen. A lot of the time, patients don't want to actually make the effort to come in if it's not going to change their management. And that's it.